Okay, welcome. It's my great pleasure today to have a conversation with Martha Somerman, who is an incredible role model, a fabulous colleague, and a dear personal friend and mentor. So it's my delight today. I'm just going to give a brief introduction and then we'll jump into some questions that I have for Martha. Martha originally got her bachelor's at NYU and a master's at Hunter College. She went on to do her DDS at NYU, her perio training, specialty training at Eastman in Rochester, as well as her PhD in pharmacology at the University of Rochester. She went and did a postdoc at the NIDR, which was the National Institute of Dental Research at the time, and then started on her faculty career at the University of Maryland. We had the good fortune, or I should say, Bernie Matchin had the wisdom to recruit Martha to the University of Michigan as a department chair. The department at the time was the Department of Periodontics, Prevention, and Geriatrics, which she chaired for 10 years. And then she served as our Associate Dean for Research before the University of Washington recruited her to be dean. And she spent many years at the University of Washington before she was recruited to the National Institutes of Health to be the director of the National Institutes of Dental and Craniofacial Research, which she served from 2011 to just recently, 2019. She is still running a lab. She's a lab chief with a musculoskeletal lab in the National Institute of Arthritis and Musculoskeletal Diseases. Martha has had numerous accolades. She's been on quite a few editorial boards and review panels. She has been awarded multiple Distinguished Scientist Awards, both from NYU, the International Association of Dental Research, and the American Academy of Periodontology. She's a fellow of the American College of Dentists, the International College of Dentists, the Pierre Fauchard Academy, the American Association for the Advancement of Science. I could go on and on and on. She's just simply phenomenal. So Martha, thank you for spending some time with me today.
Well, thank you. That was an amazing introduction, Laurie. And I look forward to working with you or answering the questions that you have. So thank you so much.
Well, you've had an amazing career, but let's go back to the start. I mean, I know you and I both share, we both had fathers who were dentists, but I'm not so sure if I remember ever asking you the question of why you decided to go to dental school. And then from there, at what point you decided to go an academic route in our profession?
Yeah, so that reminds me of an interview for dental school. Why I want to become a dentist. And for all of us, I think it takes many different reasons and rationale. But I think at a very young age, I always enjoyed math and science. But honestly, after I graduated from college, I was very confused. I didn't know where I was heading. I didn't know what I should be doing. I took a variety of odd jobs. And as you mentioned, I got a master's in environmental science because they supported my doing this. I worked for the US Census Bureau, and I explored the many facets of New York City, which it was great to take a pause. And I took a pause for about 2 years. I also took educational courses because I realized I needed to do something real and make a lot of money. Not quite, but, and so I became a teacher in New York City. And I knew that I would enjoy teaching, but I didn't see this as a long-term career, but a good option at the time. And I did enjoy it. In fact, I found teaching math and science in junior high school incredibly rewarding and also gave me time to explore my career options. So what career would provide the blend of science with a secure job at the completion? And I realized dentistry. My dad, as you had mentioned, was a dentist, so I was exposed to many aspects of dentistry from a very early age. And so I thought this was the perfect solution. Blending the science helped me. So as a dental student, I did enjoy the art of dentistry, I also enjoy the interaction with patients and making a difference in their health. But what I found that we lacked evidence in what we were doing. And maybe it was just the way I saw it. And this was in the 70s. And the only area for me, and it's much, much better now, there are other areas as well that had some scientific basis, why we were preventing the disease, why we're controlling the blood, the bleeding gums, and also treatments that were based on some type of research foundation was periodontology. And then when I went up to the residency program and they laid back these flaps and you saw this moth-eaten bone, you remember we had individuals that smoked a lot. I said, what is going on here? We didn't know what osteoclasts were at the time and that they were regulating this. And I said, what's going on? And so I said, I'm going to become a periodontist. And I assumed I'd go into a residency program and from there go into practice. And what happened was when I was applying to the residency programs, I made a mistake. And rather than discussing why I wanted to be a periodontist, I discussed all about research and how exciting it was and what I wanted to add to this area and the questions I want to address. I applied to 2 programs and both programs said, don't you want to get a specialty PhD and we'll support it. Oh, that's great. That sounds good. I had no idea what it meant. I really didn't know about an academic direction, but the rest is history and it proved to be a perfect match for me. But I also think it's a learning lesson for students. I noticed that a lot of our students and my postbacks, my fellows always ask me to look at their letters. I was stupid enough not to have somebody look at it. So I wouldn't recommend not looking at it because they can always make it better. But I am sure if somebody would have looked at my letter, they said, this is not what you should be writing if you want to go into perio practice, and would have modified it. So when you're writing letters, it's good to ask people, don't ask too many people for opinions, and then make sure that your own soul is in that letter, because who knows where I'd be if I had asked people to review the letter. So I always think it's kind of funny when I think back on it. But that's how it happened.
But you did put your soul in your letter, apparently, right?
Yeah, right.
And you've held true to it throughout your career, which is awesome. Okay, I actually have some photos here that are memories for me, and I'm just going to highlight a few of them. This is in your lab when you were at Michigan.
Wonderful memories. Great.
So, Martha, we're talking about your time at Michigan. You really had a huge impact as department chair. In fact, and this is one of my favorite photos that Russ Teichman developed, the bowling team. There's also the cover of our alumni news. But 4 of the faculty that you recruited went on to be deans of peer dental schools. I think that's probably unprecedented in our profession. And I'm just curious, how, in retrospect, how did you set up an environment that these faculty were so successful in their leadership paths?
Yeah. Honestly, it was a lot of luck, much luck, and also great recruits such as you to the department, and also the great administrative support. We had an incredible administrative group as well, and also our faculty. And so important was I was very fortunate to join the University of Michigan as the department chair at a time when there was rebuilding of the School of Dentistry. The university had made a major commitment to this, and they hired a visionary, a dean, Dean Bernie Matchin, who understood the importance of research and also evidence-based education. He created a very collaborative department or school and very supportive environment, much due to his vision. He merged departments so that there were only 6. In my opinion, I think we had 14 to 16 at the time, and even schools now have way too many departments. And even with 6, as you know, as a chair, it's still difficult to get consensus. Another aspect of his vision, which I thought was incredible, was not to silo the research into one department, but every department had a research arm.
Which
And
we
so it
still
expanded
do.
across the clinical disciplines. And I think this model should be looked at today as well. It works. Further, and that was a dream, when I was hired, there were 4 to 6 open positions. And also the dean had agreed to provide support to build a whole new research arm. So a wonderful opportunity for me to recruit the greatest people. But honestly, Laurie, when I think back on this, I had a lot of reservations in leading a department. I was concerned whether I could handle Bernie's charge to build a strong research program and advance our educational programs. And in fact, I was very intimidated and such a significant responsibility. Leading a department encompassed not only perio, but dental public health and dental hygiene. And I think you've built even a greater department. So what did I do? I said yes, and I went to work. And as a first goal, recruiting dental scientists with an interest in research in mineralized tissues. And so my philosophy was, let's build a strong unit in some area. And I selected my own area, but I wanted to build out and recruit people in the area, but not working exactly in what I was doing. But that didn't mean people that were in the department that were doing research in other areas that they should continue. But as we recruited to focus on this, and also on the educational side, I wanted people that were innovative in their approaches to clinical and didactic teaching. I also feel, and I still believe this, that 50% of recruitment of people is the building of the team. Are they collaborative? Will they fit with the team as you start building it? And do they bring new, novel thinking to the environment? So they don't think the way you do. The vision may be the same, the goals may be the same, but they think differently. And I think that's so
But complementary, different but complementary.
Yes, that's a great way of saying it. But in my previous experiences, I know they seemed to be silo approaches, and I know that did not work. But I was uncertain about what else to do, but I knew building synergies was critical. I did my homework about you, and then a bit of good luck. And as new faculty joined, they brought new ideas, great ideas, and then they became involved in the recruitment process and also in our strategic action plan. So we were a team working together. And an added advantage is the University of Michigan. So it's always enjoyed a great reputation as a leader in education, research, and patient care. So we were able to attract the best. I for sure made mistakes, and I'd like to believe I learned from these mistakes to help guide our department. And then it grew under your leadership, and then under Will Gianoble. So it's just been a wonderful experience for me to sit back and watch the growth of the department and the school as well.
Well, I don't know what the mistakes were. Whatever they were, you hid them well. My next question is more about you and how you were able to continue your faculty role while doing this incredible leadership feat that you did. I mean, I always looked at you and was just so impressed that you continued to do research yourself very successfully with R01 grants. You taught both in our school and in pharmacology, and you continue to do patient care. So how did you do all that?
Great, complex question. And further, I guess I must have been a good role model because I think you did it better than I ever did. But for me, I believe that the chair position helped me to formulate the type of leader and role model I wanted to be. And as I mentioned previously, I believe the mistakes I made along the way were learning experiences for me. So if you want to be a leader, you need to know all aspects of the program that you're responsible for. I think some of this you can do with shadowing and networking, but it's ideal when possible to be involved directly. Boots on the ground is, I think, a strategic move if you're going to do this. But importantly, you have to make sure you have a supportive, highly creative team with diversity in thinking and interests. And listen before you decide on making any decisions. And then make sure your faculty understand and know why you're doing what you're doing. And this was a lesson learned because early on I thought as a role model, if you see me doing this, that would be good. But I found that some faculty were saying, well, she's not caring about the department. She's off seeing a patient, or she's off doing her research. So learning to communicate and be expressive about why really helped. And that was a learning lesson for me. Next, you need to like to multitask. So different administrators do things differently. It's not for everybody, but it fits the way I work and think, so it's good for me. I believe multitasking as a dean makes you appreciate all aspects, the needs, the concerns that the staff are facing, because they're coming from many different backgrounds, and you really need to understand this. One example that I always find interesting is the research faculty. And I don't like the way faculty point fingers at the other group, but the research faculty were saying the clinical faculty don't work long hours the way we do. And I was able to say, you know, on a day when I'm in the clinic or I'm seeing patients, at the end of the day, it's a different part of my mind that's used, and I'm exhausted. I can't go home and I can't read research articles. But on a day that I'm in the lab, I'm ready to go home. I can't wait to continue reading and reading and reading. So it's a different mindset. And for me to be able to articulate that from both parts, I thought really helped me as a leader. But I also realized that you can't be a master of everything. So with time, I originally had faculty practice a day a week, then down to half a day a week. Then I've always kept up my license and continuing education courses and exams. But then when I became a dean, it was only special needs patients. And I also realized I'm not going to be placing implants. So I think I've always been a good diagnostician, but that was a piece that I really had to let go in terms of a full clinical practice. So
I think it's really insightful. I love the way you described the different mindset of when you're doing research versus the clinical piece, because that is so true. It's not transferable in just hours or minutes of the day. It's really a different mindset, but so valuable that you could be in both those mindsets and hence relate, you know, with empathy, so to speak, to all your faculty, because you understood those roles. I think that's really important.
Yeah, I hope I understood them.
At least you tried, you know,
Right.
in all cases. So this picture reminds me that, you know, whether you know it or not, you have been an incredible role model for other women in our profession. This picture shows you with Hong Zhao, who I think was your first PhD student. I could be wrong. Yeah. And it wasn't until after you left, I actually ran across some documentation from the advanced program on campus that listed the fact that you were the only female department chair on our campus in any of the STEM fields. So that included medicine, dentistry, public health, and engineering. And that was something that I had never thought about. And I'm just curious, you know, were you aware of that? And, you know, are there things that you would share with us about being that only person in your role?
That's a great question. And just looking at that picture, and I think it's today as role models, probably you as well, Laurie, we tend to attract more women to our labs. And where it's usually the other way around for many other labs. But, you know, when you ask these questions, you always have a way of making me smile, even in very, very tough times. And I was not aware of this fact whatsoever. And when I think back on it, and say, oh, that's interesting. For the most part, I really didn't think this was anything unusual, because on campus and also at our school, there were women that were leaders. Maybe it wasn't the chair of a department or a dean of a school, but they were leaders, and we were supportive of each other, and I think we enjoyed times outside. And also, I was not afraid to point out situations where it wasn't working. I'm not too sure, though, if anyone was responsive. So I'll give you an example, and maybe you know this example. 6 chairs sitting around the table. 5 men, 1 woman, myself. And they decide on Fridays at 5 o'clock, they're all going to go out for beers. Every Friday, we're going to go out for beer. And I said, I can't do this. I have a family at home, and I'm not going to go sit having beers with you when I have to be back end of the week with my family. Of course, Bernie got excited about that. He decided to go to beers as well. Every once in a while, he'd drop in, and I was excluded. But I did mention it, and I did say, this is something I can't do. So at least they knew why I wasn't showing up. I think back on this, Laurie, and think if I had said that today, would the reaction have been different? Would they have tried, said, well, let's try to work out a different time now, had a conversation with me? But I think they did listen. It was somewhere in their mind of what was going on. But so when you think back and reflect, I'm sure for you, you can remember. I could probably tell some other stories as well. So.
That makes me think to ask one of those chairs if they remember that and what their reflections were, because I think you're right. People look at that differently now than they did then.
Yeah.
Yeah. So my next question is, you've spent a lot of your career in academia, but obviously the last almost 10 years now in the government. And this picture both is from you winning an award at the IEDR, and you were dean at the time at Washington. And then this one from Forsyth, you were representing the NIDCR in this photo. I'm just curious, are there things that you can share with us about the difference in these leadership roles in academia versus government?
Yeah, I'll share some of them probably, I'm not even, well, whatever, I won't share. But I some of the things are the same. So just briefly, what's the same? Interestingly, in both, as I move across, one of the things I realize is that age makes the heart and the mind more tolerant and less judgmental. And so I think that was good in both places. I became a much better listener. I learned rarely to say no first, but let me think about it. And I learned that the process matters. Even sometimes I get very impatient, but you have to listen to people, and we have to go through a process, gather the data to inform decisions. In both places, that's the same. But beyond this, the environments are totally different. So at the university, there's a competition by departments for limited resources. All or many are very valid issues, but not necessarily selfish. But how to evaluate the departments for the competing agendas is never easy. The most difficult aspect of the deanship, you may disagree, is satisfying everyone's needs for very limited resources. So as a dean versus a director of an institute, when you look at a dean of a school, the goals are so broad. Students first. So the alum wants you to graduate the best dentist in the community. And yet research matters, because without the research, without the evidence base, then you don't have the appropriate healthcare. So you need both. Then clinical dentistry, and with the expanses in the technologies and tools, and what are you going to select for your school with all the expenses? So the simulation models were just coming on board when I was moving to the deanship at UW. So with these various areas of focus, you have your faculty, your department chairs, each vying for my department. And they're sometimes in conflict of the needs of another department and their agendas, and they start conflicting with each other. So with limited budgets, this is not easy. And the buy-in is almost never totally achieved by all the departments. Then you go to NIDCR, NIH, and the staff are all about research. So in a way, it's a more defined model.
More focused.
More focused. So what can we do to make the NIDCR recognized as a strong research institute? That's what everyone wanted to do. They wanted NIDCR to be recognized on the campus, both intramurally and also extramurally, to be the best. And so it's a very supportive team with a very common mission. And I must say they had better administrative support. While our administrative support, UMich, was always great, And I didn't say this, but government supported NIH was much better, but I never said that. And I'll give you an example that really made me realize the difference between NIH and universities. And it's just differences. So within the first few weeks when I arrived at NIDCR, the staff presented me some initiatives, and these are directions that we're going to go for our extramural community. So what are special areas of research that we should make an announcement on, that we want you to focus on these areas? And so they presented, several, and then I had to make a decision on which ones we should go forward with. And I said, okay, so what are the next steps? Do we talk around the table? They said, oh, no. We presented and now you just decide. And I was like, oh no, how do I handle this? I don't know how to do this all by myself anymore. But it was really an amazing eye-opening of it's all about you as a leader for the staff to make sure that we look the best we can be. And so a different type versus buying for each department. I know you're smiling, so I think you.
No, I mean, I know just from talking to you over the years, you really enjoyed that. Was refreshing, I think, to you to have that change in experience.
Yeah, not that deanships aren't great and you can do things, but it's a very different mindset of the support team you have.
I mean, I remember thinking when you were chair and you were starting to navigate to, a new role, I remember thinking that you would be fabulous in the pharmaceutical industry, leading a, pharmaceutical initiative. So perhaps that's not so different than the NIDCR.
Yeah, it's a focus. Yeah.
Yeah. So you're still active. I know you have a lab in your science, but you've taken on some new roles, the Frontiers Journal. You've been working with the Santa Fe group. I'm sure there's other things. I'm just curious, from your vantage point now, with all of these different roles you've played and your knowledge of the dental profession, what areas do you think have the most impact for the future in our profession?
So that's an interesting question. So when you say the future, I guess I will assume the future of healthcare versus the future of the world and other things. So, and when I think about it, maybe I'll go into a little detail on different pieces, but it's the same thing. We shouldn't take a silo approach where one part of the profession is going to have more of an impact than another. I think all aspects will have an impact. It just will be different. And then we need to work collaboratively, which unfortunately at times we don't. Those in practice, some come back, you enjoy the alum that come back and interact, but many don't. So we need to do a better job of that. Having said that, I believe that impact's going to start at the academic institutes and the research informing practice. The new educational models, I think we've learned a little bit from Zoom. We've learned what doesn't work, but I think we can do a much, much better job of synergies across the healthcare systems at a given school, where there's more exchange, and it's not just one lecture, but in fact, there are different courses across the schools. And then I just don't understand, some dental schools have stronger researchers and stronger clinicians than others in a given area. Why can't we share across the 60 plus schools, 66 schools? You probably kept up on how many dental schools we have, rather than us all developing our own curriculum and then not evaluating it totally and moving. And I also think that we need to share integration across medicine, dentistry, nursing, and vets. So the vet model, they've done a better job of teaching pain management than medicine and dentistry. So what can we learn from that? We talk about it, but we don't capitalize on it. So
yeah, you and I talked about that a lot because, of my background in veterinary medicine. And at the time you were doing research supported by veterinary funders.
Yes.
We used to talk a lot about veterinary education.
Yeah, and then we don't take advantage and some of the diseases that humans have. So, But then I think on the research side, there's going to be an exponential growth, and I sure hope, in the integration of medicine and dentistry with the clear evidence. And in some cases, we need to do better at the research side, hopefully not just the dental community, but collectively in these oral systemic connections.
Yeah.
They put the head back in the body. I think in terms of diabetes and uncontrolled diabetics, that's something that's obvious. The insurance companies are now covering the dental aspect, but the fascinating microbiome, the oral microbiome, the GI microbiome, and the impacts of these interactions between the microbiome from different places where they have one effect on one tissue, another effect on another tissue. You know, will there be a screening when you come into the office for your microbiome and knowing your risks now and where's the future? I believe that's going to happen.
Yeah.
So
And that
that's-
must have been really exciting for you as director at NIDCR when all the microbiome research was being launched and yeah, and really important discoveries made.
and dentistry, you know, these uncultivable bacteria, you know, microbes, and dentistry has always been the forefront in that area. And then we have potential for salivary biomarkers and other things like this. So as the research arm, though, as this research arm expands our molecular understanding, then we have the tools and technologies. So you have the molecular coupled with artificial intelligence and machine learning, 3D imaging. And again, we've been the forerunners in this area, but with 3D imaging and facial recognition, intraoral scanning, being careful of the ethical issues. But this is going to improve diagnosis, risk assessment, genetic diseases, surgical decisions. And then, as I mentioned, with these salivary diagnostics and biomarkers, I think the pandemic has highlighted, one is the importance of saliva as a viral load, but also to use it as a diagnostic for whether you have the COVID-19 disease or not.
Yeah.
That's one, but this is a beautiful model to follow through. We can't stop now.
There's
Another area.
endless amount to do, right? The exciting work is plentiful.
Oh,
You need more people.
yeah, we need more people. We need the universities to support the dental schools and give more faculty positions. But the other area that is frustrating to me, and I know frustrating to you, is the whole area of the interoperability of electronic health records. And that has to advance, and that we can't sit still on this. In medicine, there are problems across the border. There should be a one-stop. I come in, whether it's into a medical office or a dental office, I have your electronic health record and I know what's going on. For me, in dentistry, when a patient walks in, it shouldn't be sit in the chair, let me look at your tissues in the mouth. We should have the profile on that patient. We should know what's going on, what's their blood workup. We're taught to do a blood pressure, which is very simple. When we're in dental school, you go out. And then I remember as a periodontist, and probably you as well, when you were examining their lymph nodes, you had to tell them, because this was something that dentists don't do. And what are you doing over here? And it should be part of the practice, not something you have to explain to your patient. So, and you know, with the electronic records, you have the genetics, the genomics, the proteomics, the metabolomics, so much more. And we have to do this. I mean, it's real. And then, of course, the awareness of telehealth, perhaps more in telemedicine, but I think in rural communities where they're having pain and getting right onto that telecommunication before you end up in the practice would be good. And then we must, and it has to be in the future, addressing inequities in healthcare. I mean, the gaps have increased, not decreased, while some groups are improving the gap in these health disparities. And there's absolutely no reason. Some of it has to do with the access to care and cost, but we have to be part of the solution here as well. And I probably can go on and on the future, but I feel where the time is ripe. I feel so excited about the future and the future for the dental students and their practices as well as researchers. It's explosive.
Yeah, you're you're spot on. I mean, there's a lot of exciting work.
Yeah.
So part of the reason for this interview is about leadership and a leadership elective that I have with students. And so I'm wondering if you have any advice for dental students that are interested in leadership roles as their careers unfold.
Yeah. So suggestions, and it's an N of one, so that's where it is. But I think first, graduating as a dentist, you're highly regarded by your communities. And I think that's really important as well. So don't just confine yourself to dental areas of leadership as a profession, but take advantage of your education to be a mentor to others, to lead healthcare improvements for your communities, to be a healthcare advocate, and to address health inequities. And you owe this to your community to be involved. So I know early when you're starting your careers, if you decide to go into practice but want leadership roles there, I'd say all of you should think about one thing for the year, see if it works. If it doesn't work, it doesn't fit your passion, next year find something else. And it's so rewarding, and I think it will add to your practice. Going back on the academic side, I think, I was thinking about crossing the street, stop, look, and listen. And I think that's really important to take a look around, see what leaders look like. I know I was thinking, when I think about that, when I would go to a lecture sometimes and sit in the back of the room just to listen to something. And when I was getting distracted, rather than getting distracted, I would look at that person lecturing and say, why are they bothering me? What is it that they're doing that really is something that I don't want to do and I hope I'm not doing? And then on the reverse, when I saw somebody that I just, even if it was a topic I knew nothing about, they were so engaging. And so always take advantage when you're looking around. Don't walk away. When it's bothering you, stay there and try to figure out what it is. I think that's really important. And also to shadow, if you can, and ask a lot of questions, but do your homework before. We love these senior people love mentoring. We really do. And so don't be afraid, but don't just keep asking questions. Think about why you're asking those questions. I think that would be more beneficial in getting something out of it. And then listen. And of course, networking is so important. And then our associations, from the research associations to the dental associations to the specialty associations, without naming specific names, have become so much better at establishing mentors for you. So take a look at those and really get involved in those associations early on as well.
That's a really important point, and it's really important for the concept of networking that you mentioned. It's
to do that, and they're doing so much better, as you know. And then I guess it's that networking piece, but also I always say this, and it's so, maybe you say, oh, it's obvious, but it's follow your passion. You have to figure out where that is, and I think if you follow it, you'll be successful. Enjoy the ride versus mapping out some specific plan in the beginning. I found some students have a plan, and it's like, no, don't have a plan, just enjoy it and it will come. So
great advice. Great advice. It's been really delightful catching up with you, Martha. Is there anything else that you would like to add that we haven't covered that you think would be valuable to share?
Yeah, maybe I've sort of said this, but I think it's important for students early, or faculty early on in their career, to keep your eyes wide open. There's so much, as we just discussed, that you can do in emerging science, tools, technologies, and it may lead you in directions that you've never anticipated. So take them, take the risks in your career. It can be so rewarding. So Laurie, I thank you so much. I really had a fun time doing this with you. And just thinking about the future gets me excited over and over again. So thank you.
Yeah, no, especially this year, it's a treasure to think about the future.
Yes, yeah, absolutely.
Thank you, Martha. I mean, I always enjoy catching up with you, but this has just been really fun. And, I just will say again, thank you so much for all you've done for our profession and all you've done for me personally and professionally. You're just an incredible role model. Thank you.
Feeling is mutual. So thank you so much, and have a good
Stay
rest of
well.
the day.
Stay well.
Bye.